Hi, Professor and everyone. Good evening. I'm sorry for filming this video so late because I'm preparing some of the information to put all together. And first of all, my name is Jeff. Nice to meet you, everyone. And well, in here, my main area of focus, the subject I would like to, to share with everyone is regarding to the infertility. But if more specifically is the infertility related to PCOS, we know that nowadays, that so many, people, that get sick, or get disease without any, like concerns or without any, notice. So that's why, even like PCOS, nowadays, like, oh, all the young girls and all the sudden why they like growing the hairs or their the hormone the period doesn't come so that's why this is the part that I'm kind of very interested. And then I was lucky that in my facility in the office I been practicing it most of I got like so many cases regarding to the PCOS. So that's why I was like, oh, okay, so I want to like to focus on this area since nowadays in United States in biomedicines and traditional Chinese medicines like we are talking about, oh, how should we eat healthy. But I think right now is that we change a little bit the subject is that how should we eat less harmful, because right now we're talking about all the food medicines, but 99% of all the food are contaminated all with the medications. And then that's just the food part. And then imagine that we also like taking all the medications, all those the supplements. It's how much damaging our own health and body. So that's why it's the main focus I would like to focus on infertility, but related to the PCOS. And for all the information I have search and learn. And of course mainly like here it's because the most common is endocrinopathy, that the woman's due to the the chronic anovulations, and then polycystic ovaries, etc. And then all this is related involved with the lifestyle interventions or medications, like here like metformin, oral contraceptives, or like anti-androgens. And this remind me, that several years ago, a friend of mine, that he went to the hospital for a checkup, and then he brought his daughter, with him. And then while they're waiting, for appointments, all of a sudden there's a nurse just, you know, close by and ask like his daughter like, oh, how old are you, and then what grade are you, and then oh, have you like trying or have you heard about antiseptics or this kind of, oh, it's really good for female, for especially for young girls, everything. And then well, my friend, he was shocked, because he's also acupuncturist. And when he heard, I was like, oh my god, like you did, right away come to do all their like promotions, introduction of their products. And then like his daughter just like around like a 15 or 16. So that's why like so many things like doctor or nurses that they don't tell about, and then just want to want you to take it. So that's why that imagine like us as a acupuncturist, that we or learning, and then like we know, oh, what's the advantage and what's the disadvantage, pros and cons. Imagine for like all the populations, like over like 70%, that they don't know anything of this. And then the doctor and nurse just like close by, and then I'll give you this, and then you just take it without asking the questions, right? So that's why all this information like really I'm searching. I was like, oh my god, it's like nowadays it's very like we gotta be very careful, because if we just taking those, and then it can affect, to our health, to our hormones, reproductive, symptoms, imagine the future, like, you want to have your own family, to have your own kids, and then you're taking since teenagers, and then it just messed that up, with your own body, your hormones, without notice. So that's why, I have seen so many, like cases, like, female, young girls, or even like marriage, and then they've been struggling, like, so many years, and and not able to have a baby. So that's why, this is, the part, I would like to focus on, and the information I have gathered. And then, so this is, since, I have seen so many, like, patients, related to PCOS, and then I would like to share, like, here, which is my assessments, the parental actions. And then also is because, I have, I would like also like to share one of my case. It's more like personal, which is, related to my wife. And, before, we got married, and then when we were dating, she's also having, PCOS, like, syndromes. And then, like, so that's why, I've been treating her, helping her, around like, 4 or 5 years. Of course, like, each patient is, the conditions vary, right? Someone can right away, someone takes longer time. So at that time, I was, like, helping her. And then some of the, like, her period, and through like, all these years, and then her period got, like, regularly, which is, really effective. I, basically with, acupuncture, uh-huh and the Chinese herbs, and then through these years, I have tried, like, pills, capsules, like powders, and then, well, except the decoction, because it's like, more difficult, need more, preparations. But s- besides, for decoction, most of the patient, it's hard, like, to accept it, because, due to the, the taste and everything, and especially for the, Western patients, it's hard for them to prepare, and then to accept the taste. So that's why, at the beginning, I, like, I gave her, the pills and capsules, but the function, didn't really, like, very, like, visible. And then, so that's why I changed to powder, and then increase the dosage and everything, like, can, more, like, change the dosage and everything. So that's why, and then her feedback is like, right after 1 week, she felt, like, 90%, like, worked. So that's why, I have confidence, it gave me, that kind of, the directions, how to treat, the PCOS. So that's why this is, why I want to, like, focus more. And then also is that I just start, like, my own practice. So I hopefully, that in the future, can, more and more, patients, regarding to the PCOS, that I can help them. And then, that, because also my wife, she's a pediatrician. She works in the hospital, and then she sees, so many, like, teenagers, and then struggling with hormonal, with mental health issues. So that's why, it's really good, that we can work, like, Chinese medicines and biomedicines together for, all the patients. So yeah, this is it. My, little, like, sharing with everyone. So please give me all the feedback, suggestions, advices. So thank you so much.